spherocytosis. This is a very important topic, very important topic. We will learn this in a detailed manner, which all undergraduates is required. So there is no end to the subject. We'll make it concised so that you will remember well, and main thing, you can produce that much in the exam to fetch the more marks. Yeah, that is the main motto in UG classes, right? Yeah, let's start. Okay, RBC membranes, not this membrane, we'll see a bit microscopically. Okay, draw with me so that you will remember well, and you'll be having a class notes to revise well. So these are your spectrines. Yeah, this is alpha beta, this is spectrin, right? Yeah, then we have a one more complication. This one, what is name of this person? We have ankyrin. Then we have band 4.2. Then we have band 3. Okay, I got it. I think you people draw. Okay, this is one part. We have so many things in this band, but we'll study what is required. Okay, don't mess up with the every single information, so that at last you will be like, which all to study and nothing you will study. You will go with some simple online, so some material, and you won't fetch anything at last after this much struggling. Make proper concise notes. Every time I say the same thing, concise notes is key to success, especially in medical. Yeah, okay, this is called vertical interaction. Okay, I hope diagram is clear. This is a normal thing we and you are having. So now we'll see what HS people will be having. Any mutation, okay, any mutation in vertical interaction, what will happen if something is defect? Something should happen, and we are studying that is hereditary spherocytosis. And very important, this is autosomal dominant. Autosomal dominant. If it is autosomal dominant, yeah, medical life is not so easy. There must be some complication, right? Yeah, here we have the complication. This alpha spectrin, this defect is autosomal recessive. Very important, you need to remember that defect is autosomal recessive. Okay, then you need to ask, there is one more question. So मैं हूँ, ये हूँ, वो हूँ, no, we have to know who is most common. Most common mutation in HS is, this award goes to ankyrin by. Yeah, don't forget, ankyrin defect is the most common one. Many people come and go in the film, but only Hawa stays is actually hero. But nowadays it is converting to heroine. Let's focus on the hero, okay? Yeah. And one more thing. One more thing. So what is the use of this spectrin? It has two components. Simply burdening the thing, burdening the subject. No, yeah. It has some specific function. This gives shape for RBC. Who maintains shape of RBC? Spectrin. Okay, I hope that is clear. So now we'll come to the funda. Yeah, funda. Mutation happened, story started, then what happened? Your normal decent RBC is converted to spherical RBC. Then what happens? Yeah, then what happens? Just think, there is some guy who is ready to kill someone. Yeah, your spleen. What happens? Spleen entrapped in splenic sinusoids. Due to deformity. What happens? Okay, अब तो आइसक्रीम मिल गई, and your spleen is very happy when he sees ice creams. So what happens? When you see ice cream, you can't control, right? And your splenic macrophages. Okay, we discussed about this splenic macrophages. What you'll call this as littoral cells, right? I said about this in my video, right? If you not watched, kindly go and watch after this video, not now. Complete this. Okay, littoral cells, what they'll do, they will destroy RBC. अब तो खाएंगे आइसक्रीम खाएंगे. Then what happens? I discussed, if the hemolysis takes place in spleen, that is called as extravascular hemolysis. And what is the other one other than the extravascular? That is intravascular. Features, you remember, right? Hemoglobinuria, then we have that heme plus globin reutilized, heme, meth heme, and other one what is it? Find out, comment it. Okay, so we have intravascular hemolysis. So here it happens, what happens? Extravascular hemolysis happens. Then what happens? Then अब तो ज़्यादा खा रहा है तो कुछ होना पड़ेगा ना. अब तुम आइसक्रीम ज़्यादा खा रहे हो तो क्या होगा? मोटे हो जाओगे. मोटे हो जाओगी. स्प्लीनोमेगाली. After eating so much ice cream, spleen went to the mirror and saw, okay, now I became so much fat, I can't eat anything more. So this is the story. Now story तो पता चल गया. अब एक्टर कैसा दिखेगा? How the actor presents with the symptoms. So patient, come in please. Patient will be adult, obviously hero will be adult. Then he has low grade hemolysis. Then ice cream, he says, I loved ice cream a lot, so I ate a lot, so now I became fat. Then what happens? Pigmented bile stones. Yeah, okay, so patient presents with, he's adult, then low grade hemolysis, splenomegaly, pigmented bile stones. Then someone comes to your OPD and you can't send him back. Okay, चलो जो होता है अच्छे के लिए होता है, go जी लो अपनी ज़िंदगी. You can't say like that. So you'll proceed with the lab investigation, right? So in that, very important, you'll find something which I discussed in my RBC indices video. What is the meaning of MCHC? If you want in detail, just go and watch my that video. या प्रमोशन पढ़ाएंगे यार, जाके वीडियो देखो, हमारा भी तो कुछ फ़ायदा हो जाएगा। या नॉलेज बांटने का भाई, पैसे का बात नहीं कर रहा हूँ। या देन व्हाट हैपेंस, देन सोचो, देन व्हाट हैपेंस, you will check the peripheral smear of the blood, hemoglobin freely. But what happens when you see this hereditary spherocytes person? Hemoglobin will be compactly arranged. Okay, let's see the normal RBC. Think this is a normal RBC. ऐसा नहीं होता. Still just think it's a normal RBC. Okay, central there will be 1/3 central pallor will be there. This is normal. Okay, this is normal. But here what happens? It is lost. You can see there is no central pallor. Okay, I hope clear. MCHC increased. Hemoglobin is compactly, like loss of central pallor. Okay, so when you see this RBC, what it looks like, we have three features. It looks darker, it's smaller, then no central pallor. Yeah, we have one common thing, So what are they? Darker, smaller, central pallor. Okay, so now you did the investigation तो हो गया भाई, पैसा बर्बाद कर दिया। कुछ तो बोलो डॉक्टर जी, क्या हो गया मुझे, पैसे तो तुमने बर्बाद कर दिया करके बोल रहे। Then what you'll do? Yeah, you need to interpret it. So you see spherocytes and you'll jump into diagnosis that, yeah, this is hereditary spherocyte, and examiner will be waiting when you'll say, okay, spherocytes dikh gaya, okay, then hereditary spherocytes, then he'll mark directly 0. Why? Because medicine is not that easy. Okay, so we have something else planned here, and that is, when you see spherocytes, first you need to suspect autoimmune hemolytic anemia. So to differentiate it, we have next step. Okay, patient को अब you need to say like, okay, थोड़ा पैसा बर्बाद हो गया, वो ज़्यादा नहीं है, we'll go with the another test, and he'll be like, oh, पूरा जेब खाली करके ही छोड़ोगे भाई तुम तो। Then we'll say, no bro, we need to confirm it, whether it is a autoimmune hemolytic anemia or your actual spherocytes. And he'll say, what is this? Don't say him. First you need to find out whether it is autoimmune hemolytic anemia or your spherocytosis. Okay, then Coombs test, if it is positive, then it will be autoimmune hemolytic anemia. If not, yeah, we are near our topic diagnosis, so we have to diagnose that it is our topic. Yeah, not like that. Here we are studying about spherocytosis, so we are diagnosing. Yeah, if you find this, like learn this with a proper conceptual manner, then you won't forget it, right? Coombs test negative आने से दो हो जाएगा, G6PD deficiency or hereditary spherocytosis. Okay, this much we need to do circus. Yeah, then again we need to do screening test. Okay, what all screening test? Screening test we have, yeah, physiology experiment. Did you forget? Osmotic fragility टेस्ट. टेस्ट पे नीचे आएगा, आरबीसीज नीचे आएगा, कुछ तो हो जाएगा ना. लाइक यू विल बी लाइक, okay, what is the use of this osmotic fragility test? Yeah, here is the use of this test. So what you'll do normally, you have normally RBC, you'll add hypotonic solution. So you added something should happen, and what happens? RBC swells, which leads to burst. फट गया भाई. Then what happens? Then take this patient's RBC with the same condition, hypotonic solution. Then what happens? Already it is compactly arranged. If you pour more water into it, then what happens? I mean, water matlab hypotonic. Yeah, now don't spam in comment section, sir तुम तो आप तो मुझे water बोला था hypotonic solution. वाह. Don't, it's hypotonic solution. Okay, confusion? No confusion, right? Yeah, then what happens? Bursts early. This word is important, early, as compared to normal, which means osmotic fragility increased or decreased? Yeah, increased. Very important, right? So we have some theoretical things. Remember this: 0.8 to 0.9% isotonic saline, 0.4 to 0.5% normal RBCs lyse. Then we have 0.7 lysis of spherocytes. अरे भाई तुम तो बोल दिया याद रखने के लिए. What is the use, sir? What is the use? Okay, let me explain the use. See, this is the graph. Okay, it's not coming, we'll learn here itself. So what I said, 0.7 lysis of spherocytes, 0.4 to 0.5 normal RBC lyse, 0.8 to 0.9 what happens? Isotonic saline. So focus on this 0.7 lysis of our spherocytes. There is no much fancy magic, something happens here. At this point lysis happens, and normally usually RBC's lysis at this range. So what happens? So it is from go here to it is going here. Okay, so if something is shifting, yeah, something shift. What is happening? Shift is happening. So which side it is happening? Right side. So what you will say? This is shift to right. Yeah, there is no doubt, right? Very clear, very important. When you get a graph, you need to learn this so that to answer it. Okay, yeah, it's a lame still. Yeah, You can't help, man. You need to learn. Okay. Then coming to see, these are your spherocytes. How you can see compactly arranged. Yeah, if some hypotonic solution goes inside, then fata kalas. That's it. Okay. Then coming back to the topic. Yeah, I'm not joking. Just write properly with me so that you will get a proper notes. When you just on the video during your exams, just go with my video, open your notes, then just see once. Yeah, you will remember well with. I'm not just cracking the jokes, I am making concepts so that you will remember well. Cracking jokes here and there just to make some concepts so that you will remember. Don't remember jokes, remember the concept. Okay. FCM. Okay, always remember FCM. If I write, it is flow cytometry. We will learn about this flow cytometry details in other videos, because this is not the video where we named it as a flow cytometry. We'll named it as hereditary spherocytes, like so. Flow cytometry, we use a dye called EMA, eosin 5 maleamide. It's very difficult to remember all these stains. I don't know how you people will remember, but you have to remember somehow to pass the exam. So then we have, so what happens, this EMA, it binds to band 3. Then what happens, staining. If staining present, then it is normal. If it doesn't stain, that it is hereditary spherocytes. Okay, hope this is not fast. What happens, here is a RBC. You are doing flow cytometry, you put a dye, then it binds at this site. The 3 things we did on that band 3, it binds. Then if there is a stain or not, there are only 2 possibilities, right? If it stains, then we call it as a normal thing, normal flow cytometry. If it is negative, if it doesn't stain, then we say hereditary spherocytosis. Yeah, finally. So after learning this, patient says, okay भाई, इतना तो बताया, पूरा मूवी का सब बताया. So what is the climax? ट्रीटमेंट बताओ भाई, ज़्यादा कहानी मत बताओ. So treatment, what is the treatment? Splenectomy. हम आइसक्रीम खाने वाले बच्चे को ही ख़त्म कर देंगे. So if you do splenectomy, everything resolves? No, it's a big no. Spherocytes still persist. हम रहे या ना रहे, spherocytes तो रहेंगे. Yeah, this is the story of hereditary spherocytes. So let's revise a big topic. So what all we learned, don't forget the name of the chapter what we started. Okay, it's a quite big video. Yeah, it is very important topic. So hereditary spherocytes, it's autosomal dominant. The कहानी में ट्विस्ट कहाँ पे आएगा, डिफेक्ट, ऑटोसोमल रिसेसिव. मोस्ट कॉमन mutation in hereditary spherocytes, it's ankyrin. Okay, spectrin function, shape of RBC. We have band 3, band 4.2, ankyrin, spectrin, and this whole portion is called as vertical interaction. So this is the normal RBC structure. So any mutation in vertical interaction results in hereditary spherocytosis. Mutation, RBC, spherical shape, spleen entrapment in splenic cyanoids, splenic macrophage, destroy RBC, extravascular hemolysis, splenomegaly. So patients presents with adult low-grade hemolysis, splenomegaly, pigmented bile stones. Lab investigation, you will see MCHC increased, spherocytes. Spherocytes are usually darker, smaller, no central pallor. So something you got, then you have to decide which disease it is. So it's extra work. What extra work you did? Spherocytes if you see, then next step what you'll do, Coombs test, if it is positive, AIHA. What AIHA is? Autoimmune hemolytic anemia. Then if it is negative, then we'll get hereditary spherocytosis. Then we have G6PD deficiency. We do screening test, which is osmotic fragility test, normal RBC, hypotonic solution, RBC swells, bursts, khatam. Hereditary spherocyte RBCs, hypotonic solution, hypotonic, हीरो बनने के लिए गया था, ज़ीरो हो गया जल्दी, duck out. Okay, so this is osmotic fragility increases. Then we have two images related to hereditary spherocytosis. So in this we have graph of that osmotic fragility. 0.7 पे lysis of spherocytosis happens, 0.4 to 0.5 पे normal RBC lysis happens. So this is a shift to right. What? Shift to right. Then we have cell which we studied detail there itself. Okay, this is the normal and this is hereditary spherocytosis, spherocyte cells. Then we have investigation of choice, flow cytometry. Dye, we use EMA, eosin 5 maleamide, which binds to band 3. What happens? Band 3. अब पॉजिटिव हो गई तो नॉर्मल है, अगर नेगेटिव मिल गया तो स्पीरोसाइटोसिस है. देन व्हाट इज़ द एंड ऑफ द स्टोरी? वी डू स्प्लीनेक्टमी एंड कहानी ख़त्म होता है, लेकिन हम नहीं छोड़ेंगे. सो आई थिंक दिस इज़ द Nun movie ghosts, they won't leave, right? Yeah, I hope you enjoyed. It's a big video. See this 2 times or make proper notes so that you will remember well. So we completed a big topic, hereditary spherocytosis. So thank you. Don't write this in the notes, okay? This is for you people to watch my video. Subscribe, yeah, don't forget. Many people just watch. I'll get motivation to do more videos if you subscribe. Yeah, thank you. Have a great day. Bye. Catch you in the next video.